Yes.
So, is there still
So
any echo?
I think from my end, there's no echo at all. I don't know if it's coming from your the room that you are in or something. Let me check now. Hold on.
Okay. Just let us know if this voice is fine and there's no echo. If the echo is mild, so and they can understand what we're talking, I think it could be fine, right?
Yes, it could be fine. I think it's better now. Yeah, it's clear now.
Okay, good.
Okay, so
Yeah, someone was asking for the Arabic. We just have to tell them if you want to write an Arabic إذا بدكم تكتبوا عربي الأسئلة بنهاية اللايف ممكن نلحق نجاوب الأسئلة بالعربي. Okay? So getting back to you, Dana. Thank you.
okay. So basically, I'm just going to repeat a bit of what I was saying. So basically, I want to discuss with you what I went through, my experience, the first time I had baby MJ. What I was saying is that I thought it was natural. I thought you just, you have the baby, the milk comes out, and your baby latches, and you're perfectly fine. So this is what I thought, but reality was I had the baby. There was no milk coming in. I did not know that a mother's milk does not come in the first 2 or 3 days. I did not know
Okay.
that there's something called colostrum that comes out, and that's it. The baby is just happy with that milk. I thought, yani, and also I thought that the baby would naturally just latch and know how to suck the milk out, Yeah, but this was not the case. Unfortunately, this was not the case. By the way, I'm going to try to speak slowly because I'm still getting questions about the echo.
I think one lady is asking there's echo. I don't know why, but
Many
for
people
me, I can.
are writing it. I think I will try to make it as far as possible.
Hi, Mick. Mick is asking where the earphones is better. Let me try. Okay. Because she's the IT expert there. Just give me a second.
You can just bear with us 1 minute.
It's okay. I hope it's clear now.
I don't hear any echo anymore.
Inshallah, no echoes. Can you hear me well?
I think it's okay now.
Rana, is the voice better?
1 second. Let's wait for them.
I did put the
yeah.
Earphones is already
much better. On. Okay, so
yeah, thank you very much. Okay, Mick.
So
all right, thank you.
Like
Go
I
on.
Like I said, I thought it was natural. I thought the baby would latch. I thought that the milk would come in. I did not know that, and I didn't have support. Yani in the hospital, no one came and told me, no, you should put the baby's head like this, or no, if there's no milk, it's fine. There's colostrum. I was in such a bad state. Yani I got so depressed because my baby was crying. He was hungry. And I couldn't give him what he wanted. And for me, I never thought I would give formula. Not that formula feeding is bad. I'm not shaming anyone into formula. Any feeding is good. But for me, my expectations was what I chose for my baby was breast milk.
Yeah.
So I remember going home and just having a lot of pressure, like from family, from members in the family, like, oh no, don't use formula, the milk is gonna come in. Okay, Tab, it's been a day and a half and my son is screaming because he's hungry. Like, what can I do, and then the milk started coming in after like 3 days. But before these 3 days, I actually gave a bit of formula because he was very hungry. And what happened is that I started pumping, and it's so funny because I thought when you pump, you just keep pumping until the bottle is full. So I remember, imagine, I would stay for like an hour and a half using the double pump on both breasts, thinking that, okay, so now I'm going to have, milk. So I would, imagine. And then I would stay like an hour and a half. And then I didn't know that you're supposed to have like 20-minute sessions, or I thought it was like, oh no, you need to stay for, an hour and a half. So an hour and a half, I would get like 20 ml or 30 ml, I swear. If I got 60 ml from one breast, I would celebrate. I would like tell my mom, look what I have. And then I realized, and then like after a few days, I noticed my friends were telling me, what do you mean you're pumping for an hour and a half every 2 hours? So all you do in life is pump? I'm like, no, I'm putting my baby on the breast, but he's screaming and he's not getting enough milk. What do I do? And then I realized from my friends, imagine, that they only have 15-minute sessions or 20-minute sessions. They have a full bottle. I'm like, what? What do you mean? What are you talking about? Are you seriously having a full bottle of milk in 20-minute sessions? That's crazy. I never heard of something like this. So imagine, I was sleepless. I was exhausted.
Yeah, sure.
Depressed.
I
didn't know what to do with this baby. I wasn't feeling as strong as I should. The milk wasn't coming in as much as I should. I started blaming myself. I would go inside the bathroom between maybe every feed and I would cry. I would cry, thinking I was, a loser. I did not know how to breastfeed. What's going on? I should start giving formula. What should I do? So I think for me, unfortunately, it wasn't a successful venture. I ended up even having less milk. By the way, I took fenugreek, I took the teas, I took everything, but nothing happened. I went to the doctor and unfortunately, the doctor was like, what are you doing? You need to stop breastfeeding. This is not working for you. And when I went to the doctor, I went not because the milk wasn't coming in, but because I had so much pain and I had an infection, I think. So the doctor was like, oh, no, khalas, no need to breastfeed. I'll just give you a pill. It will dry your milk completely and you will not feel any pain. Just give formula. So for me, I thought, khalas, it's not on the cards for me. So after 3 months of giving 20 and 30 ml plus formula, I decided to stop. And to be honest, I think it took me a very long time to get over it. And it really made me depressed. And even now, after 3 years, looking back, I always think, oh my God, like why did this happen to me? And I kind of blame myself for it. So the point of the story is, because I really don't want to take a lot of your time, is that this time around, which is my second baby, alhamdulillah, I have the support that I need. I have the education that I need. I spoke to you about all my problems. I hired Babies and Beyond. I'm like, listen, I need a lactation consultant. I need someone to help me, give me all the information. So you gave me information. You told me that, no, not to expect milk the first day or two, that the baby colostrum is more than enough the first 2 days for the baby. And there's certain ways to do it. And there's a person, and the nurse in the hospital after I give birth is supposed to come. It's her job to come and help me breastfeed, to come and give me this positive experience. So it doesn't have to be bad for everyone. I think the main issue here is knowledge, information, and seeking help and telling people. I think in a culture where it's a bit, and I feel in the Middle Eastern culture, you don't really talk about it so much, which we should start being more open about it, talking about it. We don't have to feel always pressure from, our family members or something that we're doing something wrong. No, seek help, speak to a lactation consultant. It does not necessarily come naturally to everyone. And hopefully, inshallah, you will be less depressed and more willing to, and I remember what you told me, Nasreen, the other day. Depression was a major part of it. If you are depressed and your what is the hormone called?
Oxytocin milk.
This
hormone.
This hormone, when it's high, it really affects your supply as well. So I think, so that's also what happened to me in a way. So inshallah, now after I give birth, of course, Nasreen, expect me on your WhatsApp every day, like, hey, Nasreen, what do I do now?
You're in my heart now.
Yes, because I'm really planning on breastfeeding and pumping
Inshallah.
both, because I work and I have, so I need to focus on both, the bonding and the pumping as well. So yeah.
Okay.
This is my story.
Thank you, Dana. Thank you, Dana. Before we start with by comment, I already wrote down the notes again to highlight on the main things. And I think through my highlight, through your story, many questions will be answered of yesterday's or today's, life ones. So I want to thank you again. Thank Babies and Beyond again for inviting this session and inviting me as well. Basically, as you said, and I think everyone knows now, even if you struggle, Dana, once you know what are the reasons and you search what are the reasons of the problem, you started learning, this is part of your solution for the next baby. So half of the problems will be solved, inshallah. The only thing you need to keep in mind, even the negative pressure or the negative experience on the first baby, I need to keep it aside, focus on the second baby. And as you said, the knowledge. Knowledge is very important in the Mediterranean, or let's say the Arab or Asian culture mainly, not like the Western. We still don't get like antenatal teaching, prenatal teaching, breastfeeding teaching. We just do it as natural because our family did it, and that's normal. It is a natural process, but because we had a pressure of artificial milk companies, we had so much struggle, we were, let's say, not ready physically or mentally through pregnancy or birth, the birth experience, the baby hospital or non-baby hospital experience, all these would be affecting your breastfeeding scenario. So I will be highlighting again on that topic, which, as I said, the knowledge is very important. Seeking help from expertise like lactation consultants, lactation specialists, midwives who are knowing more about this, or nurses. Not all the nurses and midwives know. Not all the doctors, unfortunately, know. It's like a sub specialty for people who are interested to get more information. So you need to be expert with that. If anyone else will tell me, let's say the gynae doctor is supposed to be a gynae doctor, yes, she studied gynae, but she studied how to treat the problem. She didn't study the natural way of things. She didn't focus on breastfeeding. So even a gynae doctor could really go further for studies of being a lactation gynae doctor. The second thing is a family support. I do believe like the family support will be having two, let's say, extremes, either black and white. It could be a family support that helps you to continue breastfeeding, which is good. And another way, sometimes too much support and caring without knowledge could really put you back from breastfeeding. Some families will pressure you to put artificial milk. Some families will tell you as culture, your mother didn't breastfeed, so you cannot breastfeed. Your sister didn't breastfeed, so you cannot breastfeed. So many factors. So you need to know and analyze which part of family support you are having. Is this family support to help you grow with the decision of natural breastfeeding, or it takes you away from natural breastfeeding? Another thing you were mentioning, the hospital. Now, regardless of the first hospital experience or the second, hospital quality of care is something. Baby-friendly, mother-friendly protocols is something else. Everyone knows when I do my live sessions or my consultations, I talk a lot about this because I'm expert. I was a baby-friendly leader for a hospital, and I have lots of experience in the UAE, so I know what is going on in the policy. Since I've been also a child-based educator recently, we need to put in involving the protocols in the hospital. So we have two main informations for the mothers to know. If you have to plan for a birth or following your pregnancy, follow a baby-friendly hospital or a mother-friendly hospital. We have many baby-friendly hospitals in UAE. Majority are government, the private still less. However, the mother-friendly also hospital, we have only 3 in the whole UAE. So really? Again, it's going, yes, I can list very far of them.
And Anna, I mean, is this your opinion or is this like a fact? Like there's a...
No, this is an accreditation, Dana. Yes, it's an accreditation process. It's a quality accreditation process related to mother or baby friendly. So let's say mother friendly.
I need to check if my hospital is like that. Okay, cool.
Well, as we discussed a few days back, even if your hospital is not baby friendly, you have another key to support your decision for breastfeeding is seeking help, like you did with Babies and Beyond and myself. So you have the Babies and Beyond to help you. Yes, and after birth, Babies and Beyond will also support you in case if you have difficulties. Lactation, also home visits will be there. And you still have myself because I'm part of Baby and Beyond as well. So if you want an online visual consultation or home visit, they will be helping you as well. So again, even if you're not in a baby-friendly hospital, you still have that sort of support. And this is very important for ladies who are listening to us. You don't have to go to every baby-friendly hospital if you don't have it in your country or if you don't have it in your city. But if it is a plan and you're able to catch this plan, please ask for a mother or baby friendly hospitals, because the huge protocols, it's not the same as a normal hospital. In a normal hospital, they will give you bottles, they will not put the baby skin to skin, they will not even ask you to demand feed the baby. So many things, differences between the two sectors. Another thing is very important is, as I said, the concept. You still don't know, even though it's a natural breastfeeding, but you didn't know about colostrum. You didn't know about the changes, physiology changes on your breast. You didn't know that even that small amount of breast milk at the early stages, it's really enough. The baby's stomach size is just the size of the marble or the cherry, the small cherry. So it doesn't have to need more. The small frequently feeding with corrected latch on, corrected position and latch on the breast, baby will really get enough. Another thing which is really interesting, funny part, but it is really also something strange, because today I got another comment related to your also comment. Your comment, you were thinking that I need to pump for 1 hour to get a milk supply. Well, the quality of pumping, according to the mother storage, it could range between 10 to 20 minutes, which is normal. Whatever quantity in your breast will be just resolved from the pumping. But keep in mind, if you just fed the baby, what is remaining is going to be pumped. But if you didn't feed the baby for a few hours, then that is the storage capacity that you already pumped.
Yes.
And that's why sometimes you were getting 60s compared to the 20s. So maybe you had that big gap for storage and then you emptied. On the other hand, we had another very funny concept today on one of the clients. She read somewhere, and this gets back to me to your Googling, Mr. Google. I don't like Mr. Google. However, it is helping us. Okay,
Dr.
one lady
Google.
today, Dr. Google, okay, one lady told me she read somewhere that I need to only naturally pump, if I want to use a pump, only after 6 weeks. Imagine that a mother who struggles and she has a very good milk supply, that theory tells her she doesn't have to pump until 6 weeks. And she's counting exactly how many days the baby is really on. So that was something new. And I added to the myth of the breastfeeding, wrong informations. So pumping is very important to resolve any issues of difficulty of latching, baby refusing breastfeeding. Pumping after 72 hours of birth. The first hours, let's say the first 3 days, will be your hand expression. And after the milk, where it is really increasing by 30, there's something I don't have milk, it's increasing. You had the milk from pregnancy. After breastfeeding, naturally on the first hour after birth, you will be having that oxytocin shot, and prolactin will continue to produce the milk. By third day, you will have that milk supply will be much more triggered, and again to the demanded supply that you're doing with the baby. So expecting to use the pump after third day. The first hours until third day, you'll be having the hand expression, okay, to stimulate and to make sure that you collect the milk if you need it for the baby.
And it's a certain technique, right? The hand expression. It's not like you just squeeze your breast. It's a certain technique.
Yes, we have special videos to explain that, because there'll be some mail on the videos because we cannot show them anything. But if you really need to know more, you can get back to the Babies and Beyond. They can drop a question and they can get back to me to answer you, or get also to my account, Lamsa11. So just keep in mind, as I said, pumping is very important for you. And as I said, Dr. Google, getting back to Dr. Google, you can't go to Google and put any questions, because the resources are not trusted. It could be funded by artificial milk company, where they are biased to let you seek help with the if you struggle, you go for a bottle feeding rather than getting an express milk or a donor milk or even direct latch on of the breastfeeding. What else we wanted to say? A reason for engorgement or mastitis, because you didn't have effective feeding, you didn't have effective emptying of your breast, you had that mastitis or infection on your breast, and that's why it put you into infection. And unfortunately, the doctor, gynae doctor, she saved your life. I do believe this is her part, but since she's not educated about breastfeeding, unfortunately, she made you to stop naturally the milk process by giving you medicine. But if you were handled by a gynae doctor who she knows about breastfeeding, she's a lactation consultant, or like a lactation consultant, nursing background or whatever medical background, she seeks help with the gynae doctor. She will let you know what is the proper management. The proper management with mastitis and engorgement: pumping, direct feeding, taking the treatment to resolve the infection. That is very short with these quick comments.
Okay.
Do you want to add things of the highlighted answers I gave you, like baby-friendly hospitals, mother-friendly hospitals? I think you want to know more. And what else you want to tell me before getting to the questions?
I just want to know, like, sorry, something just came up to my mind now, is that when I'm doing the hand expression, the baby is going, the milk is going where? Like, okay, I'm doing the hand expression, so the milk
in a cup.
We're losing this milk, or like, where does it go?
No, you need to do hand expression to collect it on a container, in a container or a cup or the bottle itself. We don't mind that. You're aiming to collect.
Like it's not, there's no hygiene problem, like my hands, or
you just have to wash your hands with soap and water, do the massage, and empty with hands to collect the milk. The main reasons is to stimulate your milk production and also to collect the milk in case the baby struggles with feeding, because we don't want you to have a problem of the extra milk stored and you get mastitis or engorgement at the early stages. So you collect the milk to save yourself from any infections, plus you are collecting it for the baby to use it. Now, if you are after 3 days, you're easily using the pump, okay? But for many mothers, even who are not able to get pump, let's say she got a baby in a weekend and she could not buy it, or husband is somewhere else, she needs to use hand until she gets a pump.
True.
Yes, true. She needs to use her hand before she gets her official pump.
And interesting question, Houri here is asking, and give it to baby through a syringe. I've seen that on Instagram quite a lot, where they're giving the milk through the syringe. What's the reason?
That's a good question. Okay, that's a good question. Thanks, Houri. Yeah, that's why I told you. If a baby-friendly hospital, okay, the baby was born a baby-friendly or mother-friendly, if you had a struggle with breastfeeding, they will let you express your milk either hand or pump, whatever, or even if medically justified that you needed to use artificial milk at the early stages in the baby-friendly hospitals, they will have to give it with a syringe, cup, or spoon, because you need to avoid a nipple confusion. A nipple confusion means that the baby will refuse you breastfeeding because you offered a bottle at early possible, or a pacifier, or a dummy. So to avoid this,
is better than the bottle.
Yes, which is a temporary thing, because you need to put the baby back to your breast, but it's a temporary. So you won't find this on a normal hospital. You never find this in a normal hospital unless you have your birth plan with a childbirth educator and you're a well-educated mother. You are the one demanding that for the nurses to give your express or artificial milk temporary with a syringe. But in a baby-friendly hospital, it is a mandate protocol. So you will not have to ask about this. They're the ones doing it for you. Got it? That's why you need to know where and which hospital you're choosing.
Okay, done.
Great.
Another, sorry, before we start with the people's questions, I'm very curious to know. Another question is that someone wrote as well, if we do the hand expression and the milk doesn't come out, what does this mean?
Well, it could be many reasons. We need to know the baby's age, and let's say if you really had so much engorged, like fullness, sometimes when you have a fullness breast, it takes time for the milk to really release with hand expression. But it doesn't mean I need to stop pumping or hand expression. It's like a traffic jam. When you go from Dubai to Ajman or somewhere else, when you have that car, you need to remove that car. You don't just wait and wait until morning. You need to remove that car. The same thing. You have a problem with fullness or engorgement. Keep massaging, hand expressing, or using pump. And naturally, if you use the baby, is the best. But sometimes with the very full or engorged breast, baby will be having difficulty to latch. So what we do, we tell her keep massaging to soften the breast and get back to the direct breastfeeding.
Okay, and a lot of people now, we received like 6 questions about the syringe. They're saying, where can we get a syringe without needle? Of course, it's supposed to be without needle, of course. It's just a syringe.
Well, some pharmacies will give it to you as sterile without needle. And if you get a pharmacy with needle, you just have to throw the needle safely. That's all.
But this is available in the hospital when you give birth as well, right?
Yeah, it's a syringe because it's a medication syringe.
Okay,
syringes, it's a normal syringe when you give any medicine.
Yes, so basically, syringe without a needle, it's possible because that's what they
it's best. Yeah, okay. In case if you couldn't find it in the pharmacy, because some pharmacies, they have the small 5 ml or 10 ml boxes with needles. You just get it and buy it. Just throw the needle safely and use the syringe itself. You don't have to worry. But in hospitals, they give you the free needle.
Hospital bag, I think I'm going to add this to my hospital bag.
But you have it in the hospital. You can just tell the nurses, please give me a syringe, clean syringe. That's all.
Okay.
It's a hospital item.
Okay.
But I mean at hospital or at home. And if it's difficult for mothers to use the syringe, let's say, because you need to hold this way, okay, of feeding, it's better to get a dropper like the vitamin D dropper, because some mothers are so panicked to use it as a syringe to push very fast for the baby's mouth. So what you have to do, you can get a dropper like the vitamin D dropper and keep dropping in the baby's mouth temporarily. And all these things, Dana, is temporary, not for long. It's like for a few days, maximum a week.
Just until
and that's
the proper supply comes out.
Yes, or any difficulty. It doesn't have to be the supply, but any difficulty. So please get in touch with lactation consultants.
Sure.
They will let you know the best. Okay?
Sure. So now let's start answering the questions that we got. And by the way, I just want to tell everyone that we have someone that's saving all the questions that are on the live here as well. A lot of people are asking a lot of new questions. So for sure, we will answer these. Maybe either we have another session if we see that there's a lot of demand, or you can just simply go to Babies and Beyond and
drop the same question and they will let me know.
Yes, they will let Nasreen know and she'll be more than happy to answer your question. Okay, so now which question you felt was really repeated in the questions that were asked last week?
Anyway, I have them with me now. Let me just scroll very fast. And if I feel it has been answered, I'll tell them to get, you'll be downloading the video, isn't it?
Yes, I will
24
be saving
hours.
it. I will be, yeah, of course.
Great.
I'll be saving it as well. Yeah.
Great. Okay, one of the questions by Sister Rabusha, I think, distracted baby while breastfeeding. Well, we need to know the age of the baby, because mainly the babies after 6 months will be so excited to learn and, you know, see things and touch things. So mainly many mothers, when they breastfeed, if let's say a cartoon on a TV, or sometimes a father comes over or a toddler playing around, they will be distracted. That's a normal factor. If you're really aiming for just continue breastfeeding for, let's say, a nap, or let's say if he's really hungry, you need to separate yourself in a private room, quiet room. But if it's a normal thing and you're so happy with that, he's not really hungry, it's a temporary thing. So he will distract himself and get back to your breast. But it depends upon the baby's age. As I said, if it's more than 6 months, it's a normal physiology. Now, how do we avoid sore nipples and how do we avoid sore nipples and extended bleeding? Well, again, if you know how to latch the baby properly with the corrected latch on, how to catch the breast, I mean the baby on the breast, where he needs to cover the brown tissue more than the nipple. He shouldn't bite on the nipple, because if he bites on the nipple, which means that you're getting a sore or cracked nipple. Yes. So position and latch on is very important. If you still struggle with that, you need to seek help with lactation consultant to let you know if you're really properly putting the baby. There's another hidden reason, and I think we spoke that privately with Dana. Again, not all of us know that. Only expert lactation consultants and let's say a few pediatric surgeons knows about that. If you corrected the latch on and you are assuring that your latch on is good, and that even a lactation knows that she put you to the proper latch on, it could be a tongue tie. And tongue tie would be 4 types. Now, it's another topic, but if you suspected that you're doing very well breastfeeding, but you still have pain and crack, that means you need to be checked by a lactation or an expert one who knows how to diagnose tongue tie. Okay, how to increase milk supply? Again, the same question by Dana about the sore nipple and the increasing milk supply. Increasing milk supply depends on your latch on, your position, I mean on the breast and latch on, and then your demand feeding. Empty the breast frequently, hydrate yourself, and eat well. So that will really make more milk.
Maybe we can just make this a bit longer, because I also received many questions about it. About the diet that will increase the milk supply. Is there some sort of like a magical diet that people should follow, or how does it work? Can I just eat whatever I want, or?
Okay, so I think we had another question about that. See, mainly you need to eat a very well-balanced diet, and you need to make sure that your calories during breastfeeding and pregnancy should be increased. So you shouldn't be planning on a diet, or a special diet to reduce your weight or whatever, unless baby is 6 months.
Because everyone I know starts dieting right after birth, and I feel this is
risky.
Number one, it's risky, and it's a bit toxic, like this pressure to lose weight the second you give birth.
Yes. And then 2 things you need to keep in mind. You had 9 months to increase your weight during pregnancy, so expecting that you are reducing slowly. So half a kilo or a kilo per weeks or months, that's the normal thing. You not have to dropping 4 to 5 kgs in a month, because
And
you need to make
breastfeeding,
sure.
it helps with losing weight even. That's what I
Yeah,
heard.
you're burning at least 500 calories or 600, sometimes 700 calories. It depends how much you really demand feeding.
Wow.
So your breastfeeding will burn calories. You need to eat very well. You can do a sort of exercising, like you need to have something to have. Let's say you're burning from exercise, burning breastfeeding, so you don't eat more. But it doesn't mean you shouldn't eat less. Got it?
And
So
is
your
there like a
normal calorie.
certain, يعني, I know that we need to increase our calories, but for example, let's say, is eating, let's say, more spinach gives you more milk? Is there like a certain food?
Yeah, I'm getting back to this, but my issue is just to tell you that the well-balanced diet is very important. Now,
Okay.
as we said, if you have a well-balanced diet with its rich in proteins and also,
Carbs.
let's say, vegetables and oats and carbs. Now, carbs sometimes they might reduce it because the ladies will be really panicking of overweighting. But you need not to cut the carbs at all. It's really needed in your calories
Of
and
course.
give you that energy. Now, number two, we said your healthy diet, psychology level, and I mean your mental and support demand, I mean support from the family or bonding from the family, your confidence and your resting, hydrating water is really important for increasing milk supply. However, the other things could be believed and also clinically evidence based that once you really put yourself into this, I mean diet, or let's say food, it will increase. Let's say the oats, for many people, you can make it as a soup or a cookies or whatever, or in smoothies. You can also make it in a cake, whatever. You can also have the fenugreek, moringa, any herbal teas in any culture of the country that you know, some of them they are rich in oats, or some of them they're rich in fenugreek, or sometimes they're rich in moringa or drumstick, because the Asian ladies call them drumstick in India, and moringa for Filipinos. We didn't get an Arabic translation. It's already moringa so far. Okay, so moringa is moringa. Okay, so you need to have these types of food or herbal teas inside your daily regime food. Okay, but one main factor, because you were already saying that I had moringa, fenugreek, herbal teas, whatever, but you didn't get that much milk supply. Why? Because you didn't empty effectively and you didn't have a breastfeeding effectively.
And
so you can't work with one hand. Yes, depression is the main factor, but I'm telling you, can't just increasing your food and herbal treatment while you're not breastfeeding. You can't increase this herbal treatment while you're not pumping. So it's a huge plan: pumping, breastfeeding, and fooding. Okay.
And someone wrote right now, but not mint, right? You can't eat mint because it decreases the milk.
Yes, mint and meramia. I don't know the CJ. How do you spell it in English? Meramia. Meramia will dry your milk. Yes, no, meramia will be used. Yes, meramia and the mint, nana, will dry your milk. We use meramia when you are weaning, actually, or you're having so much engorgement and you want to reduce.
Know that.
And this is, yes, meramia. الأخوات بالأردن كتير بيشرب meramia أكتر منا. نحن بنحط عليه عرقين بس إن أوقات بيحطوا كتير. So meramia ونانا, you have to avoid it يعني at the breastfeeding scenarios. Okay?
Okay. Okay.
Let's get back to my list now. How was your breastfeeding journey? Okay, you already answered that. I got mastitis and it dropped my supply to 70%. Will it be permanent or can I increase it? Now, again, we just said your scenario had mastitis, but unfortunately, the doctor gave you medicine. The proper management, even if you get mastitis, you need to continue pumping and breastfeeding, taking your antibiotics or painkiller if needed. But so your milk supply will be restored.
That's not going to affect the baby. Like for me, I would be so worried to take antibiotics while I'm breastfeeding.
Well, if it's for the medical reason and you really need it to save your life because you're having an infection, you need to take it. And how much that the antibiotic will be released into your breast milk? It's very quantities, small quantities. Now, very rare you have an antibiotic which is really, let's say, concentrated, or let's say the heavy antibiotics, which is for a very big infections. These are the ones temporary to stop breastfeeding, discard the milk, and wait for the, let's say, the treatment to be resolved.
But of course,
the normal antibiotic,
we keep pumping, but we throw the milk
pumping out. And throwing, discarding the milk. Yes, that's why I said. But for a normal antibiotic, like any small infection, tooth infection, breast infection, any sort of infection, these normal antibiotics so far are safe. Okay. And will you get your milk supply? Yes, because you need to pump and breastfeed your baby as soon as and continue during the infection. Is it normal that 1.5 years after stopping breastfeeding still have some milk? Yes. If you weaned your baby at the age of 18 months, you still have that, you know, small drops of milk in between, but it doesn't leak. It's only when you're expressing or you're really trying to see if there's milk. That's normal because it takes few weeks for your milk really to start reducing. Remember, hormones working.
Be a bit scary, doctor. Yani, Anna,
no.
My friend, by the way, this is my friend that asked this question. I found it very weird that after a year and a half, sometimes she has milk coming out. Like, it's a bit scary because I don't know if it's milk or if it's discharge. You know, like, you don't know.
No, it's supposed to be a normal milk supply, which is still leaking. Now, she needs to get to check her prolactin level. Some ladies, her prolactin is still in higher stages, and that could really prevent her from pregnancy as well. So if you felt like after a few months you didn't get, if you're planning, or suddenly you thought that your milk supply is still dropping, and dripping, you need to get the gynae a consultation to check your prolactin, and then they can give you a treatment, hormone treatment to reduce it. Because once you're weaning, it takes few weeks to, the first one, or let's say 6 weeks to 1 month to get this supply resolved, okay? But it's normal. Now, if you're worried about discharge or something weird, there could be a smell, a discharge with the redness or discoloration. But a normal milk, and subhanAllah, it will not really have that problem, inshallah, okay? Another thing, a mother isn't producing first couple of days, should be giving formula. We answered this question. Hand expression, giving express milk, and if couldn't get that much milk as whatever the medical reason, you can use the artificial milk, powder milk with a syringe or dropper if you're able to find it. Not in a bottle, as we just said. Yes. Okay. Nipple confusion.
Because then,
how to make how to make enough milk for twins. The same lady was asking, to make enough milk for twins, I just said you have to have good milk supply with resting, fooding, and everything. Now, need to imagine a mother with twins. It's not even a factor of breastfeeding. It's the huge pressure on twins. So she needs to get a double care and a double rest and a double bonding from husband and family.
Which I think is impossible, right?
Well, they need to.
Twins,
they need to get help. But no, we have so many good successful scenarios. Dana, she breastfed twins, and some of them they donated milk with twin baby. So she had a twin baby and she used to donate milk. Now again, the milk supply, prolactin level for each mother is not the same, but you need to relax, you need to rest well, you need someone to help you. And they are doing a double. You have a swing, Medela pump, doing the double thing. The same thing the babies are doing, stimulation for the breast, which is double factor as well. But she needs to be getting help.
Okay.
Are you risking for baby immunity if you mix between bottle feed and breastfeeding? Yes. Let's say if I'm exclusively breastfeeding for 6 months and also continuing for the 2 years with the food for sure after 6 months, the immunity will be as, let's say, stronger than when you are giving artificial milk. Because what happens in the artificial milk, it will really affect the guts or the small intestine level. Well, it really triggers the allergy or any problems in future. So if you have only breastfeeding, you are protecting the immunity in your baby's gut. But if you mix them, okay, how much, or let's say how frequently you're giving artificial, that will be more compared to the lady who's doing less. So let's say a mother who's taking 4 or 5 artificial milk bottles compared to 1 or 2, I think that immunity will be much more compared to this. And if you don't have it, is the best that you don't include it. Okay? So how much and frequently, when did you start? And if you're offering so many breast milk, that's the best. It depends, again, how much you're exposing the baby to the artificial milk. But I prefer if you can seek help. I'll give you a trick, because I believe you have so many non-Muslim ladies in the live session. The new baby friendly, again, this is my baby, this is my game of this topic. The new baby friendly protocols in 2018. Now, it doesn't really, let's say, follow the Muslim practices. The non-Muslim cultures or the other religions, you are ought to get a donor milk before considering artificial milk. If you go to a Western country and they follow these protocols, and recently since 2 years, you are not going to get any drop of artificial milk. If you're in a baby-friendly hospital there, they will ask you get a donor milk or a breast milk bank.
But is this
in that
legal
country.
here? Is this legal in UAE?
No, I'm talking about non-Muslim countries.
Yes, non-Muslim countries.
Now for us, because we still have a Muslim followers here, what we do, we still have a donor milk, but not breast milk bank. Breast milk bank is not, legally approved in all the Muslim countries. But if I had a sister or a cousin, donor. Yes,
okay.
exactly. يعني هلا بنك الحليب ممنوع، ولكن الإخوة بالرضاعة اللي هو the breastfeeding donor mother. I know that lady, I know that mother, and we need to highlight that this lady fed my baby. There's no issues. But to tell you why this practice is going on internationally, because we're not going to talk about the religion. As I said, we follow our religions as conditional we do. But for the non-Muslim countries, they know that if you touch one bottle of artificial milk, how much you're going to get this baby to suffer in his life. So that's why in the non-Muslim countries, they tell you, get a donor milk or a bank, milk bank, express milk bank, if you have it. Few countries have it, because again, some other cultures are not accepting that. But as I told you, if you are able to get direct breastfeeding mother, a donor sister or a cousin, a donor friend where you know either you're Muslim or not Muslim, which is better that you know that lady. And hygienically, you need to make sure that she's investigated from any infections or HIVs or HBVs and all these sorts. Okay, and that's why they want to make it difficult for people to ask for bottle feeds in the other countries.
Okay.
Does the quality of food affect the quality of breast milk? I think we answered that. The more you have well-balanced diet, the more you have a very good quality of milk, and the opposite, very sure. If you have let's say a deficiency in your body and any types of minerals or vitamins, you need to check that deficiency, get a blood test, and supplement, because sometimes that deficiency will be less also in your milk, and that will affect the baby. How can I start weaning from breast milk without irritating the baby? That's another topic. I have it in my Arabic followers, because I follow many of the Arabic groups. Weaning is another thing where you need to keep in mind your psychological level, baby psychological level, your readiness, baby readiness. You don't force the baby for that, and family shouldn't force you to do that. It is your right to ask for that decision or plan for this decision as according to your, let's say, situation or culture, whatever pressure. But it's not my mother-in-law to force me, or my husband or my cousin or whatever to tell me wean the baby. So again, you need to make sure how old is the baby, and is the baby ready for that? Is he eating very well or not? And you are emotionally ready for that. What about breastfeeding and formula at the same time? I just answered that question. How can I pump and breastfeed at the... Yes, we already answered in the live session. You can continue pumping and breastfeeding because that will help you. Can you store... Yes, breast milk from their shell. Usually they get the breast shell to use it for either for flat inverted nipple or sometimes for sore nipples.
The shell is
or sometimes they call it shell.
By shell you mean it's the, what we call it, the breast shield?
No, there's two things. I think I have something at my home, but I didn't prepare to keep it. But I will send you later a picture so you can share it with them. The breast shell, it looks like a shell itself, okay? Well, it has let's say a front part and a back part. It's a plastic sheet. So that round part will be like this and that. And you will have a hole on the back side. So that hole will be direct to your nipple. Okay, with the pressure of the bra, it will protrude your nipple if it's flat or inverted. And some of them, they use it for the severe cracked nipples and sore nipples, where, you know, that is so much irritated and bleeding, so your clothes doesn't stuck to the breast, because that shell will protect it. And it will have to ventilate it. So some of them, they collect. But some of them, they use it very rare, that it's like collecting the milk, because once you put it and there's a pressure of the bra, the milk will be leaking in that shell. So if you want to store it, you didn't apply any medication in your breast, you can use that milk. It's totally clean.
I saw a machine, I don't know what it's called, but it's like you put Haka or Willow. You put it inside you put it inside your bra, and like it collects milk, and like at the end of the day you have a lot of milk. So I'm like, wow, this is actually very interesting.
Yeah, but you need to make sure that even that the breast shall have some holes for ventilating
Yes.
the breast. So
Yes.
if you lean like this, I used to get them on the first baby when I had one side inverted nipple, but it is a normal that to produce. I had to use it only on the first baby. The other babies I didn't use. Naturally, it was coming out. So sometimes I used to forget myself. So while leaning down, the milk would be put back to my t-shirt. So
Ah,
it's
okay.
not really easy for that to. So if you're
Yes.
having that milk supply, you might get losing it in your clothes. So
Yeah.
whatever the reason you're using it, if you don't apply medication, it's clean to collect it. It's not. Now, meanwhile, for the Hakka, again, Hakka is not for a working mother, and Hakka not for a normal mother who has a milk supply, which is fine. It has, let's say, for the mothers who have that leaking, or let's say over milk supply, because some ladies, when they feed, they have that let down. Some ladies don't have it. So if you don't have it, you can't keep it because you're not going to collect that. And if
Yes.
you're working mother, you need to get an electronic machine. You're not going to use
And
Hakka
I
because
feel
it
like
will not
for
work for
people
that.
like me, like I'm just imagining with my first with my first experience, I would need something like this because one drop really counts. Like I was just
Yes, if you
begging
have that
for more milk.
oversupply.
Yeah. Yeah, yeah, yeah.
Okay, how I think we ended the third one actually. Can I pump? Okay. How to get my newborn to feed longer and stay filled to sleep
Focus.
throughout the night. Now, if to feed longer or sleep much better, it depends again the baby's age, how much you feed the baby. Are you feeding very well? Did the baby have any sort of allergy or colicky factors? So many factors to know about this. But mainly a normal baby who doesn't suffer from anything and a normal mother, the baby should be deband feeding every, let's say, 90 minutes to 2 hours, maximum
This
3
is an
hours,
important
not more than
question.
that.
Yeah.
Yes, and he should be sleeping and according to his cycle of change. I mean, according to his age, because on the first 6 weeks he will sleep in a cycle. I mean, type, and then he changes after 2 months, and then 4 months, and 6 months,
So
and for
remind
sure
me
after
what to
6 months.
expect. I'm just trying to remember. So let's say the first month, he needs to almost feed every hour or every 45 minutes, right?
No, every 90 to 2 hours, 90 minutes to 2 hours. Well, if you have
Even
less
as a
than one
newborn?
hour, yes, if you are less than 1 hour, there's something strange. He's not getting enough milk.
Yeah, that's
Okay,
what
if
happened
less
to me
than
the
one
first
hour,
time.
yeah.
He
It's
used to
supposed to be
cry
at
all the
least
time.
90 minutes. No, 90
Okay.
minutes it's acceptable to 2 hours. Some of them, they switch to 3 hours. I don't mind. You need to calculate in the 24 hours, 8 to 10 or 10 to 12 feeds per 24 hours, not in a day only.
Wow.
24 hours, day and night.
Okay.
Now, another question which sleeping. The trick answer, I know some people will do that co-sleeping. I didn't get that, let's say in the knowledge. I need to train myself to get the new concept. But I had a discussion with a nice Arabic lady last week about some theories. But the main thing we need to understand, the first 6 weeks is the part that the baby is really not knowing the environment. So you need to sleep with the baby, wake with the baby. You don't push the baby to sleep in a certain time and hours, because he will be waking in a day, sleeping in a night, and then shifting back. He will be fully awake at night and sleeping in a day. So you need to catch sleeping naps in the day with the baby. Okay. And for the question, you need to know the age of the baby, types of feeding, and frequency of feeding. When can mom start pumping? I think I answered that question. It's very early as possible. Yeah. Pumping, it depends. Every 3 hours if you're, let's say, stimulating. And if you want to store it for getting back to work, I prefer every 3 hours you can pump and store if you wish. Or some mothers who are doing much more, she can do it twice and she's getting a very good supply. But for the mothers, her milk capacity storage is less, so she has to do it frequently to collect the amount that she needs. What should we eat or don't? I think we said well-balanced diet, and avoid the things if you have allergy in yourself or you caught an allergy for the baby or the husband. Okay, but eat healthy, well diet. The last question, the one you sent me earlier, 1 second. For exclusive breastfeeding, is it okay to start night weaning? That was a tricky question, part of that. Night weaning at 6 months. Both my children didn't get that weaning and they slept very well until 12 month. See, as I said, by the time baby is 6 months, they are expecting to sleep much better than the first 6 months, because they will be having food, the time of food, and they will be hydrating and getting food or whatever. And they will be much more relaxed,
And the routine,
but whatever,
right? There will be a routine as well.
Yeah, you will be setting up the routine by 6 months, or some of them they go for 9 months. Again, it depends upon how do you really put that scenario routine for your life. But again, baby is not going to be weaned from breastfeeding at night, because if you, let's say you are a working mother, okay, the only chance that you bond with the baby is when you come back. So he needs that bonding with direct breastfeeding. You're not going to depend on the bottle express milk. At the same time, he will be, might be distracted, and some, like a lady was asking me yesterday or 2 days back, she said, even though I'm working at home, but I'm distracted because I'm doing so much work on the laptop. So the baby knows that I'm not really getting the chance. So he feeds more at night. So she knows her scenario, she knows her situation. So she decided not to wean the night. So she plans to wean the night later on. Okay, so again, you need to know your type of, let's say, life situation or expectations, your scenarios.
I think 6 months, يعني, I don't know, I'm not a professional, but I think babies, I don't know if this is again something new, but even for me at 2 years old, يعني, my son at 2 years old was still taking 1 bottle at night.
Yeah, that's why I'm coming back to this. Yeah, that's I'm coming back, because she was telling me at 1 year, or let's say 12 months, the baby start to wake up frequently at night. And that is the trick thing. Between 6 to 12, he will be feeding and getting the express milk, or let's say water, and he sleeps. Now, starting from 12 months, at least till 18 months, he might be waking once or twice. He would be thirsty, or sometimes he needs bonding. He started to really feel like he's like he needs his mother much more. Yes, because my baby is 18 months old. I remember, because the last 2 babies I'm not working officially in a hospital, so I didn't observe this in the first 2 babies. In the first 2 babies, I used to do shift duties, so the huge thing is not the same. For the second babies, where I had my babies where I'm still at home, so I can observe exactly what's going on, and they really feed after 1 year. They really feed twice more than before that 6 months. So getting back to the food and getting back to hydration. So you need to give him water very well. And if he's after 1 year, you can give the full fresh milk bottle if you want, or in a cup, whatever. So the food is very important, hydrating, giving water, and you can skip 1 feed if you are able to give that satisfaction with water and food. I had few cases, few from Saudi and few from UAE. Well, when I'm getting back to their deep consultation, because you need to get the whole history, the main key was very poor diet, either less diet, so he wakes up more, or they had a rich diet, which makes him thirsty. So you need to know what are going on before that you say that breastfeeding is causing the baby to wake up. Okay?
So I just want to say one thing. Us mothers should really appreciate ourselves more. Like, this is complicated. Yani, this is no joke. We are really strong to be able to do all of this. It's not a joke. It's so,
and you need to add this if you're a working mother.
And if you're a working mother, bless you. Like, I don't know how you do it, ladies. Seriously.
Alhamdulillah. No, that's why the key, knowledge and seeking help from expert people. If you don't have an expert people, you're going to circle your mistakes. As I told you before, you had a circle of mistakes. You need to cut that circle. So if you know how to cut it and how to resolve it, or get an alternative to help you, that will at least make you much better compared to the complicated circle. I had a similar case like you, but she's really guilty till now, and I think similar to your case, she's struggling, doing lots of things, but now she felt relieved because she knew that whatever she did is the best. Now baby started to be 6 months old, she will be talking about fooding and this thing. So again, if you're able to catch the right time, the right person, you can really solve problems at early possible rather than going deeply in the situation.
It's all about support, honestly. Like, and I'm so lucky right now, and alhamdulillah, I have babies and beyond. I have you, I can WhatsApp you. I can call you, hey Nasreen, please tell me what to do. I think honestly the key here is to have the proper information, to have the support. I think a lot of people, by the way, I noticed also one thing, sorry, I want to mention this, that sometimes when you in this, I don't know if it's a cultural thing or if it's just normal that people get judged like this, but I noticed that when you mention that, oh, I'm gonna get like a nurse or a lactation consultant, the first thing they tell you, and this happened to me, by the way, today and yesterday, they tell you, oh no, everyone does it, you can do it too. No, don't tell me that. Like, don't shame me into getting help and to getting a lactation consultant, because no, this does not come naturally to everyone. Like, I was very shocked because I mentioned it to a few people, and they were like, "Oh no, but everyone does it. All the mothers breastfeed, and you don't need support."
It's not
It's like,
fair that you
it's not
judge
fair.
people and you tell them you can't do it or you shouldn't do it. It's not fair.
Yeah.
Because the case where I'm following, I told you she's struggling. You won't imagine. She's a pharmacist. And because she's a pharmacist, the doctors are expecting that she knows everything. From my experience, when I used to have ladies like nurses or doctors or pharmacists who get birth at the hospital when I used to work, I never thought that she's a medical background. I treat her as a mother. Her experience is something and medical background is something else. So you shouldn't blame her if she knows or she doesn't know. And you shouldn't blame her if she was able to birth naturally or breastfeed naturally. You shouldn't blame her. Your situation is never like her situation. If you succeeded your situation, your factors were much better. Even if I live, let's say, a happy family life, but I struggle with breastfeeding, you shouldn't blame me. I never know that I shouldn't know that I have to do that, especially for mothers who had tongue tie. I was the one to transfer cases for tongue tie. She was suffering and struggling. So if she doesn't know how to solve the tongue tie, she will stop breastfeeding. And basically the doctors and surgical ENT doctors will just say, do it after 6 months or 1 year. So imagine this mother who wants to struggle, wait for 6 months with painful breastfeeding because of tongue tie. This is really unfair. So, so many things could happen to a mother who doesn't know what is the failure or let's say the unhappy situation for breastfeeding. And I will not call it as a failure, but mother will feel that she's a failure at that moment. So we don't want her to feel this.
Of course. I agree.
So don't listen to them. Continue with Babies and Beyond.
Of course I will. No. Honestly, this time, I really took a decision between me and myself, like everything that is, because you know what, I'm going to call myself a pandemic hero. Today, as mothers that are pregnant and giving birth in a pandemic with all this negativity, you know, going to the hospital, we're only allowed to have one person. Already, this alone, yani, is so stressful. But for me, I decided to make it positive. You know what I did? I said to myself, you know what? I'm going to give birth. Alhamdulillah, yani, one good side of COVID is that I'm not going to have so many guests coming to the hospital. There's no pressure to look a certain way. No, I'm going to give birth. I'm going to focus on my baby. My baby matters the most. I'm going to focus on my mental health. Anything that's negative, anything that's giving me this energy, I'll just put it on the side. Because today I have a bigger challenge as well. I'm giving birth to my second. I also have to think about my toddler. I have to think, it's not just the baby that I'm thinking about. So, alhamdulillah, yani, a good part of COVID, the only good part of COVID is that I will not have...
You don't have too much people pressing on you.
Exactly. or, you know, coming in unannounced or giving me their opinions that I don't need. You know what I mean? For me today, I need anyone's opinion. It's an opinion of a professional. It's either you or Babies and Beyond or anyone that will really give me a constructive, yani, their opinion will be valued, not just someone telling me what they think.
Sure.
So yeah, I'm looking
great. So your decisions are following very well.
Sorry?
Your decisions are going very well. Your plans are going very well.
Yes, I hope I stick to these plans.
No, don't worry. Just keep in touch with Babies and Beyond and myself. And also we can discuss later if you want to have a quick, you know, chat on, let's say, birth plan or any quick discussion with antenatal preparations. Because again, so many tricks. And I talk a lot, even in Arabic, I have my Arabic workshops. And also I have my English and Arabic workshops also with Babies and Beyond. So, so many really needed to be tackled to the community. They really need to focus and they really need to know what is in the hospitals going on. You have the right to decide. You have the right to ask for things if you're able to do it. But some hospitals will have their certain protocols. We don't mind, but if other alternatives will be helping me, that will be the best. So you need to learn much about hospital and birthing and all this stuff.
Okay. And by the way, I'm gonna, after I finish this live session, I'm gonna be saving this live session for 24 hours. And I don't know if there's a way I can save it more. I'm gonna check. And I'm also gonna be adding...
I think I'll try also.
Yeah, and I'm also going to be adding a link to on my stories that will tell you about the services that are provided by Babies and Beyond. Honestly, I just want to tell everyone, you know, a lot of people will tell me, oh, she's working with them, or I chose Babies and Beyond because I heard real experiences from so